Hello, today I will be demonstrating on how to take a proper ECG. These are the equipments needed to perform a proper ECG taking. Hi, good morning.
Hello.
My name is Karen. I'm a second year medical student. How may I address you?
My name is Raj Spencer, but you can call me Raj.
I've been told by my supervisor that you need to have your ECG taken today. Before I proceed, I would like to inform you that this is a non-invasive procedure and it is pain-free. I will be placing 6 adhesive electrolytes on your chest and limb lead clippers on your wrists and ankles. It requires you to remove your upper garments, shoes, and socks. Also, please remove all metallic objects such as watch, belt, mobile phones, and coins from your pockets. May I have your consent to proceed?
Yes.
I will be washing my hands before the procedure. Upon examination of the chest area, there are no scar and chest hair noted. Ensure the patient is not shivering and the chest area is clean. Raj, are you warm?
Yes.
There are 6 chest leads attachments. To locate the position of the 6 chest leads, use the angle of Lewis, also called the sternal angle, as a reference point to count down the intercostal space. To locate the sternal angle, palpate to locate the sternal notch. Use your fingers down the mandible a few centimeters until you feel a distinct bony ridge. This is the sternal angle. The second rib is continuous with the sternal angle. Slide your finger down to localize the second intercostal space. From there, you can count the third, fourth, and the 5th intercostal space. To locate the 4th intercostal space, first, you need to locate the sternal angle. This is done by palpating and locating the sternal notch. Move your finger down a few centimeters until you feel a distinct bony ridge. This is the sternal angle. The second rib is continuous with the sternal angle. Slide your finger down and localize the second intercostal space. From here, you can continue counting down 3rd rib, 3rd intercostal space, 4th rib, 4th intercostal space. V1 is located at the 4th intercostal space at the right sternum border. V2 is also at the 4th intercostal space at the left sternum border. V4 is located at the 5th intercostal space, mid-clavicle line. V3 is located halfway between V2 and V4. V5 is located at the same level as V4, at the anterior axillary line. And the V6 is at the same level as V4 and V5 at the mid-axillary line. Once all the leads are in place, you may attach the wiring as coded. Recheck to make sure the leads are still in place. Placement of limb leads in correct position. Right arm lead at right forearm proximal to the wrist. left arm lead at the left proximal of the wrist. Left leg limb lead at the left lower leg proximal to the ankle. Right leg limb lead, right lower leg proximal to the ankle. Please ask your patient to stay still when you press on the print button on the ECG machine. Once ECG is printed, check again to ensure the trace is artifact-free and doesn't require the recording to be repeated. Once you have printed a valid ECG tracing, switch off the machine. Then remove the wiring, the leads, and clean your patient's wrist, ankle, and chest if necessary. Remember to also clean your hands at the end of the procedure. Remember to thank your patient. Thank you, Raj.
Thank you.
Document the printed ECG correctly with the correct patient's details.